Hello, welcome to the third session of the Medication Therapy Management Comprehensive Medication Review Workgroups. This session is focused on Level 2 Comprehensive Medication Review and Assessment Services, really specifically focused on identifying, recruiting, and retaining patients. And today we're joined by Abby Lindy from Hometown Pharmacy, who's going to be talking about these topics and giving her expertise as well. My name is Carrie Trapston. I am with the Pharmacy Society of Wisconsin and just really glad to be able to offer this to everybody listening. So enjoy.
Thanks, Carrie. All right, so today we'll kind of go through some of the tools that you can use to identify and recruit patients for the services, specifically the Forward Health and DEPO request forms. Think about identifying areas for improvement, looking at kind of a gap analysis within your pharmacy. And then we can talk about a call script. I think that slide's still in here. So when we're thinking about doing comprehensive med reviews, we need to identify patients, right? So Forward Health does actually create a push list. So they will create a list of candidates that usually are eligible for CMRA services. It's a good idea when you generate this list, and we'll talk about how to do that, but it's a good idea to look at your records as well to make sure that they are eligible. Once in a while, people get on there for a variety of reasons and it doesn't work out. But there's some phone numbers on here. Just for background, what happens is when you are going to do a CMR prior to providing the service, you call the Drug Authorization Policy Override or the DAPO Center to get authorization to provide the service. And then they, like I said, they generate a push list. And so if you're having trouble getting your push list, you can call their help desk at that number. So just keep this as a reference if you need those numbers. So the way to get that push list from the Forward Health website, you're going to need to log into the Medicaid portal with your login, click on trade files. If you have a login and it does not say trade files as an option, that probably means that your specific login doesn't have that access. There's probably a login for your store that has that access. And I know there's a way to get that added. Carrie, do you know, is that something that Forward Health does, or whoever has the admin powers at your store has to do that?
Yes, I think it's the person at your store that has the admin powers.
Yeah.
And if not, then you need to contact Forward Health.
Yes. Okay, perfect. Thank you. And then once you do have access to click on trade files, you can click on that, click on file download, and then you can view the list of files available. And like I said, what this will do is it will give you a list of patients as well as why they've been identified as eligible. So it can be really useful to just get started. And like I said, just kind of look through to confirm their eligibility prior to calling in the DAPO approval. Notably, you do still need to get DAPO approval for the people on your push list, even though Forward Health pushed the list to you. Just notable, you do still need to do that. So this is the form that WPQC has created. I'm sorry. If you fill this out prior to calling for a DAPO approval, you will have all the information needed. You will not have to call back. You will have everything that they need. What we've done is we've taken this form and put it into an electronic care plan so that it functions as a checklist, so that when we call into the DAPO center, then we have everything we need. So just to walk through this quickly, name, date of birth, member ID. Do they have Medicare Part D also, right? Are they outcomes eligible? You want to be kind of cognizant of that. The reason that they're eligible for the level 2 service. So potential reasons are they have 4 or more prescriptions for 2 chronic diseases of this list. Do they have diabetes? Do they have multiple providers that need coordination of care? Was it a provider referral? Are there health literacy concerns? Were they discharged from the hospital or LTC within the last 2 weeks? So any of those reasons are make them eligible for CMRs through Medicaid. And then so just to kind of talk through how this is used. So let's say we think that they're eligible because they have 4 or more meds for 2+ chronic diseases. You would say, okay, well, they have hypertension and they're on lisinopril and hydrochlorothiazide. They also have dyslipidemia. They are on simvastatin and they are on Flovent for asthma or whatever it is. You would list those out because when you call DEPO, they're going to ask you, which disease state and which medications are coordinated with that disease state. At Beaver Dam specifically, our pharmacist generally kind of makes that determination and provides that information to the technician to call the DAPO center. Because sometimes that information is not obvious. However, some technicians certainly are able to do that for you. So it'll depend on the experience level of the staff that you have. So that can, when you're thinking about workflow and whose job it is to do what, you can think about kind of what your staff is able to do. And absolutely utilize technicians for that if possible. And then on the bottom here, you need to always have the pharmacist NPI who has completed the home study and is official and is WPQC, and then the pharmacy NPI that also is signed up for WPQC. And then you can call the DAPO center here with the phone number. So, and then document it all on here. Remember, the PA is good for a year. You can do 1 initial and then 3 follow-ups. And again, if you are able to have this electronically, amazing. If you're using a printed out version, it's probably a good idea to scan that in so that you have that documentation. Another way to identify patients would be to reach out to local prescribers, hospitals, even, your local public health, your aging, your ADRC, Aging Disability Resource Center, maybe your local MCOs. All of those are really great for referrals. I always recommend, if you get a referral from anyone, that you kind of close that loop to let them know if it's appropriate and if HIPAA makes sense there, of course, that you close that loop and make sure that you let that provider know what services you offered, what value you provided, what problems you found, what problems you solved, all of that. Specifically related to discharges, because getting discharged from a hospital automatically makes them eligible. Having a relationship with your hospital, with the clinical pharmacist at the hospital, whatever that process looks like, being able to set up a process so that gets referred to you is excellent. There are resources already created that can be used for marketing materials to prescribers. What we have found really successful is running reports. So we are able to run reports in our pharmacy software looking at medication. So for example, we generally start, when I have a store starting to provide these services, we start with the Forward Health push list. And then we usually run a report for anybody on metformin or anybody on Lantus, although that one is a little bit less now, and get all of your patients that have diabetes. That automatically makes them eligible, and those patients need our help. So if you get through your patients with diabetes, then you can maybe start on looking at patients with hypertension, or look at your blister pack. If you do adherence packaging, looking at those patients, and start to think of a way to identify these patients that need your help. The other thing that I find happens somewhat regularly is you may find yourself in conversation with the patient. Perhaps they're on MedSync, you have all their medications sitting there, you're talking to the patient at pickup, and there's lots of questions, lots of problems, you're going through all of the meds, you find yourself in the middle of a CMR, right? Especially for this patient population, if you have them there and you're having a good discussion with them, just go ahead and you're able to do the CMR, do the review, identify the problems, do the follow-up. And then on a case-by-case basis, it's fine to get that DAP or approval. Just call afterwards and try to get that. You don't want to be in the middle of a great conversation, identifying problems and resolving problems with the patient, and then say, oh, wait, stop. We should schedule an appointment later so that I can get approval first, right? So I find myself in the middle of CMRs regularly, so maybe that's just me. But I guess my point is just like when something comes up, when problems are identified and you find yourself in the middle of it, go ahead and continue it, document, and then attempt to get that approval as needed. Another opportunity for generating that we can call a pull list, so you're generating the list of people, is looking if your pharmacy software, or even I think the Equip platform, if you have that, identifying patients that have low adherence. That can be an opportunity, as well as, and I mentioned adherence packaging here. Goals, set yourself a goal. Can you do 2 CMRs per month? Maybe set aside 4 hours a month to do CMRs. Have some sort of a way that you're monitoring. Did you hit your goal, right? So maybe this month your goal is 2 and maybe next month is 4. How do you know if you hit it? Who's tracking that? Are you hanging something on the wall to say that you know, checking it off as you do the CMRs? Can it be a team effort? Can you do a lunch if you hit your goal? Whatever it is, that's really important to kind of keep the momentum going. One more thing I just want to say, if your goal is to do 2 CMRs per month, you probably want to identify 5 to 10 people. So maybe your goal is to offer the service to 5 to 10 people per month. And from that, you will for sure get, hopefully, 2 to 3 CMR completions in that month, right? So think about how many people, what kind of a list do I need to generate in order to actually hit that goal of 2 CMRs? I find that when it's patients that are your patients, you have relationships with them, the acceptance rate, once you get good at it, the acceptance rate by the patients is really, really high. Very rarely do I have patients say no. But it depends on a lot of factors, and it depends on the delivery, and if you're able to do it virtually versus in person versus on the phone, and what that looks like, depending on what is allowed. So just keep that in mind, that your acceptance rate by your patients will probably improve as you get better at offering it. All right, so the recruiting part. So once you've identified your list of patients that are eligible for CMRs, then it's about offering the service to the patient, okay? So it can be really useful to have one person as a dedicated scheduler. Some people are just good at this. So this person needs to be friendly, confident, really believe in the value of the CMR, and a little bit persuasive, right? So they need to believe that these CMRs are what is best for the patient, so that when they offer it to the patient can hear that and understand that. I like to make sure that when it's offered, you're offering it in a way that you're sharing with the patient why it is a benefit to them. Something like, we've noticed that you're having to come in every week to pick up a medication. Let's sit down and go through everything and get things coordinated so that you only have to stop in once a month. Or we noticed that you're taking things 6 times a day. Our pharmacist can, maybe it would be good to say their name, Abby can sit down with you and get it coordinated so that you may have to take things less times per day, and it would be more convenient for you. whatever it is. Or if a patient has a complaint because their prescription isn't ready, they don't have a refill, something's not in stock, whatever it is. What a great opportunity. That is frustrating. Let's have you sit down with our pharmacist so that we can get everything coordinated so that this doesn't happen again, right? I say whenever a patient has a complaint or constructive criticism, that's an opportunity for a CMR. That's an opportunity to set them up for MedSync. So thinking about what is the benefits of the patient and making sure that they are using that messaging when they're talking to the patient. Having a little phone script can be really useful. I think there needs to be a little allowance for flexibility so that you can get that patient specific reasoning, but having some standardization so that it's not a totally different message from one person to another can be really useful. I really like this idea of using opt-in language instead of opt-out. Meaning, I tell you why I think it's really important for you. Instead of asking, would you like to come in for a sit down? It's really easy for people to say, no, I'm too busy. But if you say, I think this is really important and here is why, when is a good time for you? Before or after hours, or Wednesday or Friday, right? Giving them options. They can still say no. This isn't like high pressure used car salesmanship, right? But it's just a lot easier for them to say yes when you use that opt-in type language. And here's a specific note about making sure that it's patient specific benefits. Also, just notably, when we're thinking about talking to providers, what is the benefit to the provider? When we're looking for referrals, right? Like we'll streamline medications, we can address some of the problems so that you don't have to, like thinking about whoever you're talking to, what is the benefit to them, not necessarily what is the benefit to us in the pharmacy, right? And then just a little pro tip, even if you're on the phone or you're virtual and they can't see you, whatever, it doesn't matter. If you are smiling, your voice sounds warmer, more friendly. So that can just be like a useful tip when you're talking to people. I use that all the time. Even when someone's yelling at me on the phone, I try to keep that lightness and smilingness in my voice because it makes things work more smoothly. So as you're thinking about reaching out to these patients, sometimes it can be hard to get a hold of them. So you want to have a system once you've identified that patient as eligible and as someone who you think would benefit from the service, that you have multiple ways to contact them. So maybe you reach out to them by phone. Maybe you flag them in your pharmacy software system. You can use a care plan. You can use a little note. You can use a pop-up, whatever your system offers. Can you put a note in with their bag for pickup? Even if you have a note in the bag for pickup, maybe you can do the CMR right when they come in, or you're scheduling it, whatever your workflow is going to look like. You just want to make sure you have multiple ways of reaching out and following up. I also like to say, if someone says no to a CMR, I really feel like that means not now. Not like no ever, but just not now. So we like to keep those flags in the pharmacy software that says they're eligible so that, again, if the patient calls and has a complaint or the patient calls with a problem that we need to resolve, oh, great, it looks like you're eligible for this. We can sit down, we can get your problems all solved, and we don't have to like go through that whole eligibility process again. So that can be a useful thing to have that electronically documented that someone is eligible. And obviously you have to like keep an eye and make sure that they're still eligible based on changes. But I really like having that in there so that if a problem arises, we know that they're eligible and we can get them into the scheduling process, get them into the CMR workflow easily. The reminder calls or texts are super important. This is something that we've really struggled with. And our pharmacy software now allows us to text people, and that has been really a useful tool for us to remind people of appointments. It can be useful to find out what their preferred method is. Do they want a phone call? Do they want a text? Do they want an email? Whatever it is. But that reminder is really important. People forget. For me personally, if it's not on my calendar, I don't show up. So I kind of think of it for the same for other people. They need a reminder. People are busy. If you call them to remind them and they cannot make the scheduled time, reschedule them right away. If they come in for their appointment, and you want to do a follow-up, schedule them right away for an appointment follow-up time. So when you have their attention, you want to make sure to either provide a service or get them scheduled, instead of saying, oh, well, I'll call you to schedule something. When you have them, you have their focus, do all the things you can do right at that time. If you're able to provide incentives, amazing. It could be, whatever it is here. They have some ideas. Maybe you have samples in your pharmacy, whatever it is, incentives. People love an incentive. People love prizes. People sometimes need a little extra bonus, and just try stuff and see what works, right? Your patient population may be different than ours. And even within your population, you may have people that really just want to sit down and talk to you. And that is, incentive enough. Other people might like a little access to a drawing. Just figure out what works for your patients. All right. I mentioned follow-ups. You just want to set the expectation. When people go to the doctor's office, they expect that it's going to be followed up. When you have meetings with people and you're going to try to make interventions, set the expectation that you're going to follow up. Schedule, if you know at the appointment what an appropriate follow-up time is, just schedule it right then and there. That's the best way to ensure it, and then make sure we're reminding them, right? And then that having relationships with your patient allows you to provide better services. When they trust that you care about them and you are going to, make recommendations and interventions that are what's best for them and their care, they trust you. They're more likely to not only come in for follow-ups, but also do the things. If you're recommending that they're checking their blood sugar in the morning, or you're recommending they check their blood pressure, or whatever it is, when there is a relationship, that adherence to the plan is significantly better. All right, I think that is all. We mentioned a phone script. Here's some examples that you can take a look at for how to create that phone script. All right, so moving on to kind of the next part of the CMR, the actual workup and assessment of the patient, and kind of what that looks like, what the pharmacist needs to do, what can be delegated to other staff, all the tools that exist, and then we'll discuss briefly the CPT codes and modifiers. So thinking about kind of prepping for doing the visit prior to the patient getting there, right? So ideally, we are getting all of the lab data, looking at the patient profile, looking at adherence history, kind of reviewing that ahead of time, so that you can actually address the issues during the appointment. And you will find that as you get used to doing this, you will get quicker at reviewing the information prior to the appointment. We don't want to be spending 2 hours preparing for a CMR. That is not sustainable. So just kind of keep that in mind. It's okay to spend a little bit more time up front, but then we want to be really shortening it down so that it's efficient for you. There are some resources that we'll actually go through that WPQC has for you, both for the patient and for you to kind of work through. But the idea is you just want to have a standardized process. So if you have access to an EHR, if you have access to different resources, then, the more standardized you can have it, the more templated, the easier it is for you. So there is a document, and I think it's useful actually to look at the pharmacy patient care process, because my opinion is that in pharmacy, we are doing part of this process literally all day, every day. We're collecting information. We're making an assessment. Is this a problem? Is this not a problem? How big of a problem is this? we're making a plan, we're helping the patient implement. We do all of that all day long. What we don't do is we don't document that and then follow up and monitor. That's the piece that I think is a challenge for us, just because of the way that our technology is set up and a lot of factors. But I think that's the piece that the care plans and CMRs and clinical MedSync, all of those different tools allow us to really do that monitoring and evaluating and loop it back around so that we can kind of get to the next step with the patient instead of, not really resolving issues. So I think that's kind of a useful thing to think about. And if you have precepted any students, you've seen that image a million times. So then there is a checklist that's available for pharmacy use to kind of what sorts of things are you collecting, assessing, that sort of thing. So this is the one for patients. So you can provide this to the patient when you schedule the appointment. It just lists all of the things that they can bring. As you know, it's not just prescription medications. We're talking about all the things, right? So this is something that you can use. You can rebrand this or co-brand this for your pharmacy and use that as a tool for your patients. Clinical. So what we're doing in the CMR is we're wanting to assess clinically, are these medications doing what we need them to do? Are there any gaps in therapy for any of their conditions, right? So some of the information you can gather during the appointment: blood pressure. You can do an asthma control test right during the appointment. Maybe you have the capabilities to do an A1C. Otherwise, this is a type of information either the patient will need to bring a print off, or you may need to request it from the provider. You may have access to the EHR, whatever it is. But you can start to think about what pieces of data would I need in order to assess whether this patient's diabetes is under control, whether this patient's asthma is under control or not, and what interventions need to be made. If you are needing to request it from a clinic or a health system, it is much more successful if you can use the release forms that are specifically from that institution. Technically, you don't need a release form, but because we are providing care for the patient. However, many institutions require it. So, play by the rules so that you get what you need in a prompt manner. It can be useful to kind of have, whether you either use the WPQC toolkit or have a printout or an online link of guidelines for the most common disease states. That can be really useful because it can just, number one, as you do this more, you probably start to memorize them. But number two, it can be just useful to know that you have them and you can refer back to them very easily. And you'll get used to what are the typical questions, what are the typical interventions, what are the typical guidelines that you need to be familiar with as you're going through. But also remember that if you're going through and you don't know the answer to something, it's always okay to tell them and then address that on the follow-up appointment, okay? Pro tip for you, if you know, and I would say pretty much always, you want to schedule a follow-up, but if you can schedule that follow-up appointment right while they're at the initial appointment or the next follow-up appointment at the previous follow-up appointment, you are more likely to actually get them scheduled and get them there and show up. So I highly recommend that. So after you make your assessment and your plan, think about what makes sense. Do I need to have them back quickly in 2 weeks, or is this a 3-month checkup type of situation? So whatever makes sense clinically and for the patient. This is just reminding, if you can review the med profile and any data that you have ahead of time, it just makes for a smoother meeting, keeping in mind that it does need to be sustainable and we can't be spending hours reviewing profiles, right? There are resources, just like there are clinical resources and toolkits, there are also toolkits related to adherence and health literacy. So those are good resources to tap into, especially because health literacy is a automatic criteria for eligibility for a CMRA through Medicaid. So those are really useful tools. You are certainly able to verbally tell patients the information that they need, to answer questions about labs, about how medications work, lifestyle things. But it can also be really useful to utilize little videos, or if you have handouts or different ways to show the patient the different information that can be really useful, and kind of helps engage the patient a little bit better. Reminder calls. This is something that my pharmacy has really struggled with. We are getting a little bit better now that our pharmacy software can text. So patients need reminders. Nobody's going to remember their appointment. So we always try to call or text the day before. And then if you're able to, text or call that day as well, to remind them, and just remind them what they can bring. If they can bring their any lab reports, any specific information you're requesting. And then I always like to remind them to bring any concerns, because we want to make sure that the patient, whatever the patient's goal for the meeting is, that meeting is addressed, or that need is addressed. So this is the intake form that you can use as a kind of a template as you go through the intake and the appointment with the patient. We have shortened this for our pharmacy because that was more useful for us, but we took this as our initial template. So I think that can be really, really important to have a process as opposed to just go in kind of willy-nilly. It's really nice to have a process and an order with which you do things, especially because that allows you then to delegate some of it to a technician. So keep that in mind, that some of this, or a lot of this, most of this can be delegated to a technician. And you just need to have certain like red flag criteria. So if a patient says they're missing 5 or more doses a week of their insulin, that's a red flag, right? So make sure to have that laid out really well with your technician so that they can make sure to bring that to your attention anytime there's kind of one of those red flags. So the prep work prior to the appointment, 100% can be a technician. So gathering the labs, cleaning up the profile, getting rid of the old antibiotics, getting stuff printed out, faxing the release forms, all of that, as well as getting the depot authorization. And then afterwards, submitting the claims for reimbursement. That can all be technicians. We're also working on, at our location, at Beaver Dam, we're working on having the technician do that initial piece of the intake and the actual med rec. What are you taking? What are you taking it for? How often do you miss it? What have you noticed? Any problems? The technician can do that. And then they flag the red flags. A pharmacist reviews all of it. And then the pharmacist can come and do the assessment and plan part, and then hand it back over to the technician to do the billing and kind of closing the loop on the documentation piece. So technicians can do all of the pieces of a CMR, all the prep work, the med rec, and the billing afterwards. The only thing they cannot do is the assessment and the plan, and a pharmacist can supervise all of the rest of it. This is a template that WPQC has. It's a great one. It can be used to make sure that all of the steps are being taken. We kind of took this and combined this with the intake form to make one document for our location. And actually a lot of it has been made virtual, or not virtual, but electronic in a care plan template, as opposed to having a paper copy. Just a reminder, if you are doing the appointment in person, you do need a signature for consent for performing the service and billing the insurance, as well as if you are doing it virtually, you do need to get and document verbal consent. All right. This is a little worksheet that has all of the information that you would need for billing on the Forward Health portal. So NPI number, member ID number, patient information, diagnosis codes, if that's what the reason is. And then here's the procedure codes, or CPT codes, and then the modifiers. And we'll talk a bit about that on the next slide. And then at the bottom is the phone numbers if you need help, if you're having any troubles with any of it. Right. So we then use 99605 for the first 15 minutes when it is a brand new patient that has never received a CMR before. If you are seeing a patient that has already been seen for any type of CMR with you before, then you would use 99606 for the first 15 minutes. And then you use 99607 for each additional minute each additional 15 minutes, regardless of if it's a new or established patient. And then you use the modifiers, either UA or UB, to indicate whether it is the initial CMR or the follow-up CMR. And when you go into Forward Health, or if you're using a different platform, there are spots to put all of these things. So there are things that just the pharmacist needs to do, remember, and then there are things that we can delegate to others. So just a couple reminders about the things that really the pharmacist needs to be doing. Reviewing all of the information that potentially the technician is gathering for you, or reviewing the information that you as the pharmacist gather. So labs, med list, refill history, all of that. The identification, assessment, and making the recommendations, that's the piece that the pharmacist has to do. Really, the technician or others can do all of the rest. The assessment of problems and the making of a plan, recommendations, is the part that must be the pharmacist. That's the professional piece of it. And then having a say in what educational materials or resources or whatever the patient's going to need to actually implement your recommendations also has to you want to make sure that the recommendations you're making are actually going to be achievable by the patient. And that is it. So if any questions come up, please feel free to reach out. Obviously you can reach out to Carrie. My email address is there. And then I did include Lori on here as well. She is the DAPO approval Forward Health billing expert within Hometown. So if you have questions specifically related to the billing, the insurance, like that piece of it, Lori is your go-to resource. All right, everybody have a great day.